Hello, my name is Gerardo Jara. I'm a physical therapist and I have a specialty in instrument-assisted soft tissue manipulation. This is the utilization of instruments in physical therapies with therapeutic purposes, mostly to release the myofascia. Instrument-assisted soft tissue manipulation has been around for a long time. Right now, the tendency is to prefer the tools that are made of stainless steel, but the history of this comes from China, where they had the washa tools. These tools were based in the concept of a chi energy that flows through your body, which is a bad energy, and with these washa tools, the energies were eliminated for the person to heal, to decrease the pain and feel better. We respect that philosophy. After the techniques were internalized into the Western culture, more research has been conducted, and now instrument-assisted soft tissue manipulation is one of the many techniques that physical therapy offers to treat the patients. It's mostly limited to the stainless steel tools, but there are other tools that are worth to mention, and I have some samples here. There are some percussion tools that emit vibrations that we can control to do a precise application. They're used to increase circulation and promote healing. And there's another type of more widespread tool that we can use for the lumbar. The first one I show can be used just about in any part of the human body, and it's usually to treat myofascia, but some therapists also use this to manipulate. In general, there are many brand names, and some of them, especially the stainless steels, are very expensive. We're talking about the Hawk grips, the Graston tools, the Zuka tools, the addition tools, the anti-slippery tools, also the scraping tools. Those are usually to release the skin and to do cross-fiber massage on scars. Then the original washa tools from China, they're also available. You can still get them, with a medical upgrade. They're actually called medical upgrade washa tools. There's also the fluid motion soft tissue tools. There are the trigger point tools, and we have one of them right here. This is made of plastic. If it is a true trigger point, the theory is that sustained pressure to the trigger point decreases the trigger point, the associated pain, and the muscle guarding that goes around, but takes time, and it also takes energies out of the therapy. So if one of the tools, it facilitates the treatment of the trigger point for the therapist without tiring the therapist too much. Hence, many therapists are using those trigger points tools that are usually, like I say, made of plastic. Then you have the FAKTR tools for soft tissue release. We just mentioned the percussion tools. And the most common in the instrument-assisted soft tissue manipulation is this. This is called the EDGE tool, E-D-G-E, EDGE tool. This tool can be conformed to use it in any part of a human body, from the head to the toes, literally. The characteristic of stainless tools is that they have to have two edges, the bevel edge and the dull edge, to be adjusted and conform to any part of a human body. There are also tools that are more holistic. When I was in Mexico, I brought me from Mexico a tool made of obsidian stone, a beautiful black stone that if you put it in the sunshine turns into green, and the Mayans have been using those for millennia. It's a long tool shape that can also be applied to many parts of a human body, and I've seen some therapists in Mexico that have used those also to manipulate the spine and other joints, not only to treat the myofascia. The first tools were developed in China, the washa tools, as explained, to remove the chi energy flowing in the body, The main theory, or I should say the initial theory to use the tools, is to create a local inflammatory response, if you wish, is control microtrauma. So some therapists still believe in that technique, and they're aggressive in using the tools to the point of creating a bruise in the area of pain, and then as the body restores the bruise, then it heals the initial injury. But that trend, believe it or not, if you go to research, is dying. I'm not a strong believer on damaging human tissue. I use my tools with the purpose of myofascial release, to facilitate leverages, to go sometimes deeper if you wish, but I personally don't try to create that control microtrauma as many theories sustain. You can go to physiopedia.com. That website summarizes many evidence-based articles regarding instrument-assisted soft tissue manipulation. Here's another tool that is used to manipulate the iliac crest, the ilium, to give axial extension to the spine. And in the market there are also tools that the person can use by themselves. Sometimes we recommend that the patient gets a tool like this so they can do self trigger point release or even massage. So the main theory that trends now is that to use these tools with myofascial release, starting from the skin and going deeper, always from superficial to deeper techniques. There is a superficial common fascia that envelopes everything. Underneath you have different muscles, and each muscle has its own fascia. And restriction between the fascia and the skin and the fascia and the muscle tissues constrain tissues, and that creates pain. There are a lot of manual myofascial release techniques, but now that these tools have been added to those treatments, It is very important that you do proper care. Always keep your tools clean. It's always recommended that a 91% isopropyl alcohol swab after you use this tool is the best way to keep things clean. So always clean the tool before and after you apply it on a patient. And also you need a media to reduce friction, so massage lotion of any kind is necessary for the treatment. So basically I can show you also some other tools for applying kneading to the spine or to any large muscle in the human body. I used to do this to release the hamstrings and to release the quadriceps. And now we're going to do a short demo. I have a lady here who has pain in her left shoulder, and she was diagnosed with bicipital tendinitis. So we're going to use the edge tool to release the long head of her biceps. So lie down, please. It's the left shoulder, isn't it? So we're going to put the pillow here. On your back, get on your back. So now she's injuring the shoulder extra. My hands have been washed, so we're going to put some prep. And the tool is also clean. A little bit cold, sorry. Bicipital tendinitis sometimes might be or might not be associated with tears in the labrum. It's a common condition, and it usually affects the long head of a biceps that originates in the superior glenoid. And on her, she's an ectomorph, that means skinny. It's very easy to find. So I have it gliding here. And this technique itself, released with my fingertip, is good enough. But Later on I will try to use the best part of a tool that can be conformed to that area. So I'm going to use the blunt edge to release it. So I'm going to go there. And that's a common application that I have for my edge tool. I use it a lot in bicipital tendinitis. You okay? Mm-hmm. So that's specific for a tendon right there. And then you can conform it to the rest of her arm. Like I said before, you should use superficial technique, then you use the other edge of a tool to loosen up. And then you should go to your specific area of treatment. In this case, the bicep head. And we can spend all the time that we need to spend to create a release. Then I'm going to follow the shape of her biceps to keep on releasing here. So like I say, this tool can be adjusted to any part of the human body. Alright, I'm going to show how to release the erector spinae. Suppose that you have low back pain, so we're going to put you this time face down. I'm going to clean my tools as you get ready and put it right back. Don't cut it. So the erector spinae is a group of muscles that backward bend the spine, and on hers is well developed, as she's a Pilates instructor. It's very easy to palpate, and again we can do a lot of techniques. I think we need to manipulate her thoracic spine because she has quite a bit of kyphosis, but we can do that in another video. Okay, and then I'm going to get a little bit of prep so I can use my tool safely. Thank you so much. I'll put it right there. And usually I always start manually. Should have given like a superficial technique to begin with. We can do that manually. But then when we're ready to release the erector spinae, in this case the longissimus lumborum, I'm going to pull it from the spine, from the spinous processes, all the way sideways. Because it has hyperlordosis, I'm going to use this side of the tool to conform to that curvature there. So in this case we're releasing the right side of her erector spinae. This is a very common technique to use a specific tool. Then with this side of a tool I'm going to do an iliac crest release. We're going to conform to the shape of her ilium. And as we go laterally we're releasing her QL, her quadratus lumborum. And this is a short video that Nicole asked me to do, so I'm showing these two techniques. Thank you very much.